Good afternoon, everyone and judges. At the onset, I would like to thank AIOC to give me this opportunity to be on this podium. Myself, Dr. Saurabh. This study was under the guidance of respected Dr. Soumya Basu sir, and my code is FP1449. As we all know, that uveitis is a disease of inflammatory disease of a uveal tissue, and it's been known for its misdiagnosis and long chronicity. In today's world, we have a lot of ancillary investigations and PCR techniques, which has helped us in finding out more and more about this disease. Till date, there have been 4 major epidemiological studies, and but none of them have actually had followed up their patients in the due course of time, and none of the epidemiological studies even states the use of any ancillary tests and all. So, keeping this in mind, to determine the factors responsible for change in uveitic disease, and we conducted this study, and it was a prospective study conducted at LV Prasad Eye Institute, Bhubaneswar, and based on certain classification, the patients were categorized and matched up and were followed up and were categorized into the inclusion and exclusion criteria. Infective endophthalmitis, trauma, and lens-induced uveitis were removed, and patients who were having remission at the last follow-up and minimum follow-up of 3 months were taken into account. So, based on that, after screening 31,000 patients, we had 750 patients we actually had which were possible to have an inclusion criteria, and out of which the number is quite considerable in comparison to the national and international studies which we have done. So we even investigated the number of clinical investigations which were performed over the duration of the patient, and we were able to find out that our diagnostic accuracies were improved with the use of our tests, and PCR and other techniques have helped us in diagnosing more and more posterior uveitis, which were commented to be an idiopathic condition. So based on the remission or outcomes at the end of the follow-up, 6 categories were formed, out of which in this study we have, I would be describing out the 3rd category. So in this, the patients who showed clinical remission after change of the diagnosis, there were 34 and we further subdivided these patients to 3 groups. And these were anatomical change, that is from anterior to posterior panuveitis, any anatomical change, and etiological, this may include anatomical change, also included and etiological changes, that is from acute anterior uveitis, the patient was further examined and we found it out to be him to VKH. And from non-uveitic diagnosis to a uveitic diagnosis, let's say for a patient who was treating as a BRV, or turned out to be an inflammatory vasculitis. So it's very important for us to have a classification of all the patients based on the Sun classification, mashing up of these patients, makes us come to a very close reality to the diagnosis. Secondly, ancillary test and use of PCR techniques have evolved our diagnosis in the due course of time, and we must think about whether our patient is not responding, whether we are missing something, because this study shows significant amount of the patients, even in a tertiary care center, might have change in the diagnosis at the due course, and taking a help of a senior might be of a good help.